In this video, let us all know about surgical lasers. First, let us start with knowing what are surgical lasers. Surgical lasers are instruments that use light in place of a surgical knife, which is used in traditional surgery called scalpels, to cut or treat a tissue. So, in normal surgery, we use a surgical knife, whereas in laser surgeries, we use a surgical laser which use a very high intense beam of light to treat the affected area or an organ. And the principle involved in surgical lasers are the stimulated emission of radiation, which is the principle of laser beam. The most commonly used lasers in the treatment are carbon dioxide laser, which is the most often or frequently used surgical laser. The second one is the organ laser. The third one is the NdOG laser, neodymium, yttrium, aluminum, garnet. Diode lasers and excimer lasers are also used in few laser surgeries. How does the surgical laser works? Generally, a laser beam or a programmed laser beam is focused to the affected skin or a affected area or to a particular organ. These lights are passed until it encounters the chromophore. Chromophore is nothing but it is the layer of a screen. This chromophore absorbs the entire laser beam. After these laser beams are absorbed by the chromophores, a heat is generated there. We all know when laser light is passed through a certain material, a high intense heat will be produced there. So, heat is generated and it is focused to a targeted or to a particular area. So, this results in the removal of unwanted tissue. So, the result what we are going to obtain is based on how the laser beam we have programmed or with which intensity we have passing the laser beam. So, by this way we can remove the unwanted tissue or treat the affected tissue. So, what is the use of this surgical lasers? It finds uses in various fields of medicine. Firstly, in ophthalmology. So, this is the main purpose of laser light. So, laser eye surgeries like LASIK, particularly for vision corrections. And in dermatology, that is in the skin treatment for the removal of skin lesions, keloids, removal of tattoos, birthmarks, pigmentation. In all these areas, surgical lasers are used in the field of dermatology. And in the dentistry, that is for the treatment of teeth, dental procedures like gum reshaping, cavity preparations, etching of dental enamels, and treatment of caries for dental drilling and all, surgical lasers are used. And in gynecology, the surgeries like pelvic endometriosis, that is for the treatment of female reproductive organ, surgical lasers are used. And in urology, that is in the treatment of kidney stones, urinary bladder, carcinomas, and for the treatment of prostate conditions, nowadays lasers are used. Lasers are also used in the treatment, used in neurology, that is in the treatment of neural tissues or neurons. And in cardiology, that is for the heat treatment, they are used in the treatment of angioplasty. Apart from usages for human, it is also used in veterinary uses. Laser surgical lasers are also used in the treatment of surgical incision or for small injuries in very small animals. And in cosmetic surgery, laser surgical lasers find many applications, especially for hair removal, skin resurfacing, teeth whitening, hair transplantation, to prevent from aging. So these are the applications in cosmetics. Okay, though we have a traditional surgeries, what is the uh, advantage of going for a laser surgery? Firstly, there will be a reduced swelling at the surgery site. So, in traditional surgery, a surgical knife will be used, a cut will be made there. So, for healing and all, it will take time. Whereas there will be a swelling. If you cut, there will be definitely a swelling. Whereas in surgical lasers, no such thing happens. There will be a reduced swelling, and there is no risk of infection as there is no physical contact with the skin. See, in only laser is passed here, so there will be no physical contact, whereas in the traditional surgery a surgical knife will be kept in our skin, and the recovery rate is very very quick when we compare it with the traditional surgeries, and there will be minimal bleeding, or in some cases even bloodless surgeries are also possible, and the pain here is much minimal compared to the other traditional surgeries, and it is also the surgeries are also very easy to handle, and it is a time saving procedure too. And laser lights, since the laser lights are programmed, these surgeries are more precise and causes less damages to the tissues. Though it has too many merits, it also has demerits. The surgery involves need of an expensive equipments, and we need good technicians for the usage of this lasers. So it is very very delicate, and sometimes the surgeries or the it may go under correction or over correction. It may not be sometimes precise since it is an machine programmed, and the instruments used here are very expensive, so the treatment is also very expensive and not everybody can afford to it, and there is also a very little chances for failure and opposite reaction, and patients with autoimmune disease especially cannot undergo laser surgery.